Nice to meet you all. I am Park SangEun, the representative at the Future of Africa Foundation. Well, the Global Care has been talking about how they responded to the local issues, but now I'm going to tell you about our international effort. The next slide. So let me briefly introduce the Future of Africa Foundation, followed by future challenges and our recommendations. The next slide. Future of Africa Foundation has been working for 15 years since it was registered to the Ministry of Foreign Affairs in 2007. We have been working in less developed countries or developing countries by providing education and healthcare services. So we have our branches, our chapters are working in 16 countries. Our focal activities are 7, as you can see. Together with our partners in local communities in those countries, we have been working on MNCH program. And as for the project Malawi, we have published our activities in the Science, the magazine Science. And next. So with the Covid-19 occurred, we realized that the Korean quarantine system was quite efficient, gaining a lot of attention from the international community. So we translated the Korean quarantine manual to English. You see, ranging from the screening centers to healthcare for confirmed cases and drive-through and other creative ideas were all covered in the manual, and we shared this with 16 African countries. And we also posted it at the website. We created a separate website for them, and that's koreacovid19.com. This is a new website, and you can take a look at the English manual as you wish. And we have been updating it. And next. And we have members of advisory groups. You see, in Korea we have 24 members. For example, Professor Choi from Korea University and Professor Lee from Hanlim University, and also Professor An from WHO. And at the same time, there are other medical professionals in 14 countries in Africa. They are the members of the advisory group, and we are taking some advice from them. So by cooperating, local and international professionals are working together to give a proper advice. And at the same time, we have a partnership with KOICA and KCOC. Next. According to their advice, we set a priority, and we are providing custom-made responses to each country in Africa. We have been investigating the needs and demand in Africa, and we learned that personal protective equipment, or PPE, were not really ready for medical staff in Africa. But as you understand, the number of nurses per person is only 1% of our ratio in Korea. So once PPE is not available in Africa, then the medical system will just collapse. So we concluded that we had to save medical workers in Africa, and that's actually the name of our hospital, SEM, Save Medical Workers. So we did provide PPE to medical staff in Africa, And PPE support was sent. The supplies were sent to 11 countries, and each cost 40,000 Korean won. And you see, Zimbabwe, Malawi, and other countries were the beneficiaries. And you see in these photos, Zimbabwe, Uganda, Nigeria. And in those countries, our medical doctors are working of Future of Africa Foundation. Based on their own will and based on their conscience, they were there. So with them, we were able to send PPEs to them very consistently and fast. You see 2 doctors in Zimbabwe, and this is a Verista hospital in Uganda, in Korea, Korean hospital, the Verista hospital in Uganda, and also we have them in Nigeria. So we learned from COVID-19 situation that we need a promptness on site and medical professionals working on site. And as you've seen in Africa, medical supplies and medical treatment were not the only solution for helping them. On the occasion of COVID-19, still, more people came to be starving, and some started protest, and they were shot to death, and they have to feed over 10 family members. They're still starving, and the situation deteriorates because of this infectious disease. So we started running the project to send out meals and food to those countries named on the slide. And you see these photos. And as for Madagascar, which is very huge, there are not many transportation vehicles. And we were thinking of possible secondary and second chain of infection. So we supported the vehicles to them for a better and improved transportation. So we believe that custom-made support is very important. In Zimbabwe, the COVID-19 specialized hospital was designated by the government, but oxygen is not supplied, which is really pitiful. So we sent some oxygen kit and other medical supplies. Even in the very difficult situation with a short airplanes, we were able to send them out thanks to the help of ambassadors and diplomats. We never know how long the COVID-19 situation will last. We still have to help them as we have been doing. And this is Tanzania National Hospital, which we supported quite a lot. But this hospital is not really run because of COVID-19. We have been working on capacity building consulting for the hospital, but the hospital doesn't really run at the moment. So we got an idea that we would give the on-tech monitoring to them. So one of them is this. Over the past 5 years, we have been sending out ultrasonic lithotripter You see, if you have some stones in kidney, then you have some, you can break it out with ultrasonic lithotripsy without any strong invasion. We actually sent it out, but they were not really able to do that because there was no training. But we started using Zoom and give some trainings to those doctors in urology. This is a very brief slide. Can we take a look at the video? Can you watch the video? Okay. Then let's pass. Then skip it. And then after our training, those doctors in urology were able to treat the patients. But before, they were not able to treat them with that lithotripsy. Why? Because the doctors focus on just the vertical lines, but we help them learn about vertical and horizontal axes being met. And the doctors were so happy after they successfully treated the patients, and that was even released on broadcast. And they also gave us a sincere appreciation to us. In principle, they didn't really allow us to give training at Zoom, but with the successful case of Zoom training, they said we don't really have to go there. And we actually established the 7 additional courses for them at Zoom. And we also took part in the KCOC's special committee. And to respond to COVID-19, we needed to a sort of a consortium. And together with KCOC, we are working for the special committee. And last but not least, we would like to make this recommendation. Well, I looked up the word resilience on the dictionary. There are two possible Chinese characters under resilience. One is recovery, and the other is the ability to go back to the original. So the resilience, in one hand, is the force which comes back to the original status when stable airplanes, ships are unbalanced by external forces, such as wind gusts and strong wave. But on the other hand, resilience also refers to when the nature such as water, air, soil is polluted, the power of nature to be back to the original clean status through its self-purification system. So now it's time to think about which resilience we have to take and want it to be. So we may go back to the original status of a long time ago, which is even cleaner, even more beautiful than now, or right before COVID-19. You see the lack of resilience. This is the cause of several very accident. Of course, prevention is very important, but even we are faced with challenges, we need to have an ability and capabilities to go back to the original. Next. This is a photo of 2005 forest fire at Naksan Temple. The mountain became naked, but in 5 years afterwards, it became even more of trees. Even more abundant with and full of trees. So resilience actually is relevant to a sort of self-purification system, a self-recovery system. I myself am a doctor, and I know that the we have some resilience to keep ourselves stable on. So, for example, when we take a look at the families, at the critical period of time, you may need some help. Let's say your husband is cheating, and that's the crisis. And the wife cannot really, if the wife is not resilient, then they are gonna just divorce. But if they overcome the crisis, then the family can be recovered to the original, something like that. Next. This is what I learned from COVID-19. I myself am a doctor working for screening centers. Many things disappeared. You see, the performances and arts and cultural activities, sport are all disappearing. Money has been disappearing too. But there is something left in us. For example, something essential and permanent and eternal. So based on such essential and foundational stuff, we can recover ourselves. You see, you also realized how empty it is that we see, we feel, what we are seeing in the advanced countries. They were supposed to be very powerful and strong, but they also collapsed before the COVID-19. So Korea is small, but we can be very strong. So rather than how we look like, we have to focus on growth of inside. For example, some everyday quarantine activities like hand washing and wearing facial mask, those rules should be kept. So there are three options. We just wait and see. Second, we go back to the status right before COVID-19, or we go back. Third, we go back to the original status long ago before the COVID-19. So together with other NGOs and social members and the members of society, we have to make this better and take this one into an opportunity to grow further. And the refugees and the factors and also refugees or returnees from some accidents like explosive airplanes and terrorists, or also those families, bereaved families from Sewol Ferry. I understood how resilient we human beings were. Thank you very much.